welcome to our practice. We want to make this video just to give you an idea of what you can expect on your first day interning with us. When you get here, you'll arrive about 15 minutes before the start of our first appointments at 8 a.m. So around 7:45 you'll get here. You'll be able to get settled in and meet with the doctors to see which patients you'll see for the day. So when you come in, you'll walk all the way to the back here. And in this back corner is just our bathroom and then our workbench. This is where we keep everything orthotic and medication related. Then into our break room. We have a small storage room where you can keep your stuff. It's a bit crowded, but there are hooks in here for you to place bags, coats, whatever it is that you're bringing. And then in the break room, we have our fridge where you can keep your lunch if you choose to bring it. We do have a lot of other options if you want to purchase food while you're here. Lots of restaurants are around in our complex here. Also in the break room is whenever you have downtime between appointments, or if we don't have an appointment for you to see that hour, we have dishes that obviously always need to be done that you can help with. We try to rinse everything pretty well before we put it in the dishwasher, just because there's a lot of oil and peanut butter. And then over here, we have our laundry. So if you ever notice that the washer is full, feel free to get that started. Or if you notice that the dryer has stopped, feel free to fold some towels as well. This is our front waiting area. Here's our shelves with all of our different retail products. We might sell supplements and licky mats, things like that. So when a patient walks in, if we can't put them in a room right away, we will have them wait up here. But it's important to note that we don't let our patients greet each other, and all of our patients need to be on a leash when they enter. Whenever you are greeting a client, obviously make sure you introduce yourself and then guide them to wherever it is that they might be going. So if you need them to wait here, communicate that. If you're taking them to a room, let them know that as well. All of the kind of instructions for the patient as to where they need to go will be on the patient's schedule that you'll set up in the morning in those first 15 minutes before appointments start. So then we can come back into a room here, and I'm going to show you the one other thing you can do to be really helpful in between appointments, which is to help turn a room. So we've left this room unturned just to show you a little bit of what might need to be done. The first thing is taking care of any of the laser goggles that we use. We wipe them down between each use and every appointment. So all you'll do is find the goggles bin in the room. They might be in slightly different spots depending on the room. And you'll just give it a spray down and wipe it. And then you can put it away into the bin when you're all finished. The other things that you might see is things like the laser being left on or the ultrasound that's been used here. So for the laser, you can use the water wipes that are left in every room and pull one out, and again, just trying to wipe it down between patients. So taking the laser head and just giving it a good wipe down. You might find peanut butter or dog hair stuck to it. And putting that away. And then turning off any equipment that might still be on, like the laser or the ultrasound. Then same thing goes for the ultrasound head here, which is connected over there. You'll just give it a quick wipe down between each patient. Put the cap back on and put that away. We have warmers on our shelves for the ultrasound gel that you can just put that away. And then any hot stones that we use for massage, again, we'll just take to the back, wash them between each patient, and then bring them back into the room. And then the final thing you might see here is our acupuncture bins. So if acupuncture has happened in the room, you'll just need to go through and tidy it back up, put it all away back into the bin, and then throw out any trash that's left over. Any needles will have already been put away into the needle disposal, but anything else like the wrappers for the needles or the little sheaths that they come in just can be thrown away in the normal garbage. And then last thing is we change the towel between every patient. So you'll just take the towel and you will just throw it into the dirty towel bin, or if you have extra time, you can run it all the way to the back to the dirty laundry area, and then put out a new towel. And once all of this stuff is put away, the room will be fully turned and ready for the next patient. Things that are not in this room that you might see would be, again, treacles, licky mats, or spatulas. Those you'll just take directly to the back sink. This is our dashboard that we use for appointments. One important thing for you to note is the color of the dog here on each patient's block. So you'll notice here, if it's red, that is an indicator for you that the dog may be dog aggressive or human aggressive or possibly a bite risk, so to just approach with caution. Green dogs are just really exceedingly friendly dogs, great with everyone. Black is just the standard, they're friendly, they're good to go. Orange indicates maybe shy or anxious, so again, approaching with caution. And then if they have blue, that is indicating that they are either deaf or blind. So hovering over the appointment with the mouse will allow you to see a little bit more information on the dog here. Anything you might need to know, things like pumpkin only, or that we don't take pictures of them, things like that.
There you go.
We also wanted to give you a brief introduction to the underwater treadmills. We have 2 here at our new location. And then that room back there is our storage room for the big tanks that hold all the water that then flows into these treadmills. If you want to come a little closer to the screen here, you can see this is kind of where all the operations are. So whenever we have a patient coming into the treadmill, it's important just to know how to operate this. We will actually start by putting a life jacket on each of our patients. In their records, it should say the size that they need. And then for certain patients, you might be getting into the treadmill with them. And for that, we have waders all the way there in the back. In terms of operating the treadmill, the first thing that you always want to make sure is that you have the treadmill in the proper position, so forward or reverse. If they're going forward, they're walking towards us here in this video, so towards the front door of the practice. And if they're walking in reverse, they're walking here towards this back wall. So once you get them into the treadmill, you will make sure here that the doors of the treadmill are locked, both on the top and the bottom. And then ensure that you're in the correct forward or reverse for which direction you're going. And then to fill the treadmill with water, you will just hit fill and the water will slowly emerge there from the bottom. To stop it from filling any further, you'll just hit the fill button again and then the water will remain at that level. To drain the treadmill, you will hit drain until you hear a kind of gurgling noise where only air is being sucked up through the pipes, and then you'll just hit drain again to stop draining from continuing. When we have patients in the treadmill, we want to slowly increase the speed for them once they're filled to their appropriate water height. So to do that, you'll hit start, which will begin moving the treadmill, and then you can increase speed slowly to the desired speed. And when they're finished and you need to stop it, you'll slowly decrease the speed before stopping, just so that it isn't abrupt on them. Once the water is fully drained at the end of their underwater treadmill session, you can then open the door, let them out onto the rug, and then have a towel ready. Towels are back here. where you can help the owner dry them off. When we have dogs in the treadmill, we typically motivate them with treats to keep them moving forward. So back there on that same towel shelf, we also have various treats or peanut butter that you can use to just keep them moving towards you. Some dogs need a lot more motivation than others, so it really just depends. Should be noted in their record though what type of treats they take. And if not, the doctor or the owner can obviously tell you. Unlike a lot of places that use the underwater treadmill, we don't just smear peanut butter here on the front. We always use a licky mat or a spatula to hold that, and that just prevents this from getting super dirty. And then once our patient is out, as people are drying them off, if you are not the one to be helping with drying them off, you can help by cleaning the underwater treadmill. We clean it between every single patient. And to do that, we use this spray bottle, which is a half vinegar, half water solution, and then a microfiber towel. And you're just gonna spray the vinegar along the line that's left from the top of the water, and you're just gonna wanna spray off and wipe that whole grime layer. Here is our exercise area where we keep all of our equipment. Just run through a few of the most frequently used equipment items with you, just because I know they can be called a lot of different things depending on what practice you're at. So here we have our cones and the cavalettis. These mats here are the proprioceptive mats. These pads are our fit pads. And then we have fit bones here, the fit discs, things like the rocker board or the Bosu here. And then over here, we have our Kato steps, which can be stacked, our infinity discs, and the blue fit bones. Those are probably the most common items that we end up using for exercise. Another thing you can do when there's downtime to help out during appointments is just be picking up and putting away the exercise equipment whenever you are finished using it. Over here, we have a shelf with a lot more treats. We have a few different types of treats. Again, certain dogs get certain types of treats. And then over here, we have our beverage fridge. It also has cheese and organic peanut butter for patients that need those. And then for our clients, different sparkling waters and water bottles. And then here is where we keep all of our water bowls that we fill throughout the day, because we wash them between every patient. So if you see a water bowl laying on the ground and you know that it's not currently in use by a patient, feel free to take that back to the dirty dishes, give it a wash, and refill it and bring it back over here.
To operate the land treadmill, if this light's on, then the entire treadmill is on. You hit the red button. So this is our start stop. You hit it again, it's going to count down, and then it's going to start. And this is how you increase your speed. Again, just like the underwater treadmill, make sure you decrease your speed all the way down before you hit stop. That way they're not stopping abruptly. And then you just turn off the side of the land treadmill. Perfect. These are hot stones. So when we perform hot stone massages, always make sure that you're not going to burn a patient. So place it on your skin. If it can hold it for a few seconds, then it's fine to go on a patient. We keep it at 120. When we utilize these, we just put these aside and we do wash them in between each patient and then let them dry in the area back there. That's our hot stones. We have the paw wave vibrator. So you just push this button multiple times to increase this frequency of that. And we have pressure wave massagers that we'll utilize on the patients. When you are working, feel free to go ahead and treat the patient to keep them distracted if need be, or if the doctor is talking and the patient is comfortable, feel free to go ahead and give the patient a massage. And here is our acupuncture needles. This is our laser, and this is our ultrasound and electrotherapy unit. So I'm going to go over operating the laser. In order to turn on the laser, you hit this button down here. This is the start stop. And I'll turn on. Some important things about the laser is Anytime we're pushing buttons up here, we want to make sure this end is covered. So always make sure it's in here or it's against your hand or directed towards the ground. What I've seen a lot in the past is people will hit start and then the laser is facing the client and then just lasers the client. So just always be aware of your end and make sure that you're not lasering people in the room. To get to the protocols, you hit this arrow. You select your species, which is dog. And then you can select your protocols. So you could hit, for instance, we may do chronic inflammation or acute inflammation. We may do arthrosis. Some of the doctors have pre-programmed settings. Personal, so they have their already pre-programmed settings that you can go ahead and select. Let's go back. So let's say we're gonna do acute inflammation, so post-op TPLO. Always make sure you're on point by point. So if you're lasering a dog and it doesn't ever pause in between, you're probably on scanning. So just pay attention that it's on point by point. You select whether or not the dog is white or black, and then so you select your size. Most often we're doing medium, which is gonna be about 12 points of laser, and then you hit start. When operating the laser, to start it, you hit this button, and then when it's done with its dose, it'll go ahead and stop for you to move to the next point. So for instance, if you're doing the knee, we're gonna place the laser at the stifle joint line. You're gonna run the laser. When it's done, it will automatically stop. If you need to stop it in the middle of a treatment, say the dog moved, just go ahead and hit that button again, and it will stop the laser. Once your laser is done, you will then move on to your next point. So most knees, we end up putting the knee in flexion and we just run along the joint line with our points, and then I'll move on to the next point. For hips, we usually go around the greater trochanter, and for elbows, we usually go around radial head, and then sometimes we'll do a straight line on the medial aspect. If you wanted to stop the laser in midpoint, you just hit stop. And then to turn off the laser, you push in, hold down the green button until it beeps, and then you let go. So let's go over the ultrasound unit. To turn it on, there's this button on the back right here, this little switch that you push in. So say we're doing ultrasound, we have different size probe heads. So we have, this is the 5 centimeter probe head. We also have the 2.5 centimeter, and then we have a bigger one that's a 10 centimeter. So you select your appropriate size probe head for the area. Most of the time we're using the 5 centimeter or the 2.5 centimeter if we're at a joint. We may do the 10 centimeter if we're working on a big muscle like the gluteals. On the program, you hit this button right here, which is ultrasound. Then you hit the edit button, and then you select your parameters. Most of the time we keep head warming off. Your frequency, you'll do 1 megahertz if you want to go deep, if you want to go 3 centimeter deep, or you go 3.3 megahertz if you want to go shallow. So for instance, a post-op TPLO, you may be at 3.3. You select your duty cycle. We're usually running 100%. We want to relax muscles. We'll do 50% if we're at a joint line and we want to decrease swelling. So you could run through that. And then your watts per centimeter square, you dial up. We're usually 0.6 for acute. We may go up to 0.8 and 1 for our chronic patients. And then you can set your treatment time. Most of the time we keep it at 7 and we just keep an eye on our time. Rules about the ultrasound: never let this hit air. So if it hits air, it can break our crystal inside. So we always make sure that we have ultrasound gel on the probe and on the patient. If we're ultrasounding the patient and the patient moves, just make sure that you cover the end of your ultrasound until you hit your pause button. So never let that hit air, just always cover it with your hand if the patient moves. When running the ultrasound, we'll put a little bit of gel on. So I'm going to place the unit on the skin, and then I'm going to hit start, and then we're going to run our ultrasound. When you're utilizing the ultrasound, always keep it moving, so never just hold it in one spot. So we're always doing circular motions and moving it. Be careful with the ultrasound. If you hit bony areas. So if you're hitting, like if you're on the, let's say you're doing the knee and you hit the tibial tuberosity or you hit the bottom of the femur, that can be a little uncomfortable. So make sure you're staying at your joint line, you're not hitting bone, just because dogs will react with that. The other thing to be aware of is if dogs have really loose skin, you need to stretch their skin and keep it on taut while you're ultrasounding, because the last thing you want to do is it's really just staying on the skin in one spot and then the skin's moving with the ultrasound and then you're just burning the skin. So always make sure your skin is taut while you're ultrasounding. To stop it, you just hit the stop button and we wipe off each patient in between. If the patients have long hair, we will wet these towels, and we also have a towel steamer in the other room that you could go ahead and give them a wet towel to go ahead and get all the gel off. Perfect. So this is our home button to get back to that main screen. Now we're going to do electrotherapy. So to set up our electrotherapy, we have these cords. We have channel 1 and channel 2. If you look on the screen, we have channel 1 and channel 2. So just make sure you're on the right channel. It always defaults to channel 1. So you're gonna plug in your unit and then you'll attach your electrotherapy pads. So we got black goes to black, red goes to red. You're gonna place ultrasound gel on each pad and then place it on the area of interest. On the screen, you're going to hit clinical protocols, dog, and you're going to select your area that you want to do electrotherapy. So say we're going to do hip. We're often choosing acute pain or chronic pain. So say this is chronic pain, and it already has everything programmed in. So it's going to be continuous and it's going to run between 1 and 10 hertz. You slowly dial up your intensity. So most patients were starting at 3. And then we increase from there. This bar right here tells you how good of a contact you're making. So if it's lit up all black, you're making really good contact. Right now it's empty, so it's not making good contact with my skin. And then you hit the start button, and then you run your electrotherapy. When you are done, you hit the stop button. You remove this from the patient. You wipe down the pads. And then you take this to the back and you just rinse it off underneath the sink, shake it out because you don't want water getting into the hole right here, and then you let it air dry. And then to turn off your unit, hit the back button. We also have the handheld TENS units. So some of the doctors will utilize this and they can go ahead and show you how to operate that. And I believe they also show you guys how to operate that in the CRI course. I think that is it, everything. So welcome to our internship, and I hope you guys have a good time.